Chapter 14: Symptoms and Signs. Exercise 14.1. Complete the table with words from the opposite to the stress mark in the syllable in each word. The first one has been done for you. Noun: exhaustion. Adjective: exhausted. Fatigue: fatigued. Lethargy: lethargic. Tiredness: tiredness. Tired. 14.2. Make word combinations using a word from each box. Look at A, B, and C opposite to help you. Worn out. Of color. Complain of. Present with. Put on. Out of sorts. 14.3. Complete the sentences with the correct form of the verb present. A 67-year-old man presenting with a 9-month history of increasing shortness of breath. 2. The most common presenting symptom is loss of consciousness. 3. Cranial arthritis might present as fever without any obvious causes. 4. The patient usually presents with a severe sore throat. 5. The presenting symptoms in this patient could perhaps be due to renal failure. 6. Other conditions with similar presenting symptoms include acute cholecystitis. 7. Reduced growth is an important presenting complaint of celiac disease. 8. 2 months following presenting, the patient was able to walk. 14.4. Read the patient in description of her symptoms, then complete the case report. Look at C opposite to help you. I was well until a few months ago. In the beginning, I just fell off color and a bit tired. But lately, I have been feeling completely worn out at the end of the day. I am not eating any more than usual, but I've put on 9 kilos in the last year. My motions are hard and my hair has started to fall out. Case 13. A 50-year-old housewife who had been well until 4 months previously, presenting of tiredness and malaise. She had gained 9 kilos in weight in the year before. She complained to her GP, although she denied eating more than usual. She was constipated and she noticed that her hair had started to fall off. Chapter 15. Blood. Exercise 15.1. Find words in the box with opposite meanings. Look at A, B, and C opposite to help. Adequate, inadequate, unlikely, likely, insidious, sudden, common, severe, mild, and rare. 15.2. Make word combinations using a word from each box. Look at B and C opposite to help you. Bone marrow, progressively increasing, vibration sense, pernicious anemia, iron deficiency, insidious onset. 15.3. Completed sentences. Look at A, B, and C opposite to help you. A 39-year-old man presented with a history of mild abdominal distension over a period of 6 months. 2. Blindness might be caused by a vitamin A deficiency. The bleeding and purpura are caused by a normal platelet function. 4. The white cell count is normal, so we can exclude acute leukemia. The yellow color of her skin and conjunctiva is probably due to jaundice. There was a palpable mass in the right upper quadrant of the abdomen. Treatment is aimed at restoring fluid balance with adequate intravenous fluids. The anemia might be due to increased red cell breakdown. 15.4. Complete the conversation. Look at C opposite to help you. Professor, what is against the diagnosis of pernicious anemia on physical examination? Study. The problem started quite suddenly, so he didn't have the typical insidious onset. He doesn't have any skin color, and he doesn't have symmetrical paresthesia or absent vibration sense, and I couldn't feel his spleen. Professor, what about his tongue? Student, his tongue was normal and not inflamed or sore. Chapter 16, Bones. 16.1. Level the diagram using word from each from the box. Look at A opposite to help you. 1 is the skull, 2 the jawbone, 4 the breastbone, 5 rib, 8 thigh bone, 9 kneecap, 10 shin bone, 3 spine, 6 collarbone, and the 7 is the shoulder blade. 16.2. Match the types of fracture 1 to 5 with the description A to E. Look at the opposite to help you. A. There is a break in the skin. Open. 1. B. The bone is bent. It occurs mainly in children. 4. Green stick. C. The bone is broken into several pieces. Comminuted. D. The broken pieces are separated. 3. Displaced. E. The broken pieces are pushed together. 5. Impacted. 16.3. Complete the textbook extract. Look at C opposite to help you. Reduce a fracture involves trying to return the bone to as near to their original position as possible. If a fracture is allowed to heal in a displaced position, the fracture will heal, but it might go on to malunion. Chapter 17. Childhood. Exercise 17.1. Complete the table with words from A and C opposite. Then complete the sentences with words from the table. Verb. Delay, noun delay, adjective delayed. Verbs develop, development, adjective developed. Distend. Distension is the noun or distended. Distension of distension. And the adjective is distended. Fail is the verb, failure the noun, and failed the adjective. The verb is nourish, the noun is nourishment, and the adjective is nourished. 1. Babies with the fetal alcohol syndrome might present with failure to thrive. 2. Abdominal distension might be due to an enlarged liver. 3. Small amounts of alcohol in pregnancy can affect fetal development. 4. Mortality from measles can be reduced by better nourishment. Delay in one or more of the milestones might be the first sign of disease. 17.2. Complete the sentences. Look at A and C opposite to help you. After sitting, babies learn to crawl and then to walk. A child who has started eating solid food has been weaned. Someone who is not very tall is said to be of short stature. The stages in a child's development are known as the milestones. A child who is beginning to develop sexually has reached puberty. Write the common English name for each disease using your medical knowledge. Enlarged parotid gland, mumps. Difficulty opening the mouth, lockjaw. Rash and enlarged posterior occipital nose. German measles. Paroxysmal cough with vomiting. Whooping cough. Papules and vesicles. Spurs on trunk. Chickenpox. Cough and cold followed by a rash. Measles. Sore throat and rash. Scarlet fever. Swollen joints and a hair murmur. Rheumatic fever. Fever followed by muscle weakness. Polio. Cough with a stridor. Crow. Chapter 18. The Endocrine System. Exercise 18.1. Complete the table with verbs from A, B, and C opposite and related forms. Put a stress mark in front of the stress syllable in each word. The first one has been done for you. Verb, inhibit, noun, inhibition. Verb, production, noun, production. Release, noun, release. Verb, replace, noun, replacement. Verb, secrete, noun, secretion. Verb, stimulate, noun, stimulation. 18.2. Complete the passage from a textbook using the illustration on your own knowledge. Look at the opposite to help you. Pulses of GnRH, gonadotropin releasing hormone, are released from the hypothalamus and stimulates LH and FSH released from the pituitary. LH stimulates testosterone. Testosterone production from Leydig cells of the testes. Testosterone feeds back in the hypothalamus pituitary to inhibit GnRH, secretes ESIH, stimulates the Sertoli cells in the semimembranous tubulus to produce mature sperm, and the inhibit A and B inhibit causes feedback on the pituitary to decrease PAH. 18.3. Complete the sentences. Look at A and C opposite to help you. A diffuse change affects many parts of an organ or gland. A localized change affects only one part. His diet is deficient in iron. He doesn't get enough iron. Excess T3 and T4 increase the basal metabolic rate. 18.4. Match Miss Davis' symptoms 1 to 7 with the question her doctor asked. A to G. Look at the opposite to help you. 1. Diarrhea. Are your bowels normal? D. Eating more. What is your appetite like? C. Heat intolerance. Do you prefer hot weather or cold? 4. Overactivity. Are you able to sit and relax? E. Palpitations. Have you ever felt your heart beating rapidly or irregularly? G. Weight loss. Is your weight steady? B. Tremor. Do your hands shake? F. Chapter 19. The eye. 19.1. Complete the table with words from B opposite and related forms. Verb, accommodate. Noun, accommodation. Adjective, accommodative. Verb, constrict. Noun, constriction. Adjective, constricted. Verb, convergence. Noun, convergency. Verb, no, adjective, convergency. Verb, dilated. Noun, dilatation. Adjective, dilated. Verb, drop. Noun, droop. Adjective, droopy. Verb, oscillate. Noun, oscillation. Adjective, oscillating. Verb, react. Noun, reaction. And adjective is reactive. 19.2. Match the pictures 1 to 6 with the condition AF. Look at B opposite to help you. The dropping of lids is the 6. Dilated pupil is the 3. Irregular pupil is the 2. Cataract is 5. E is the 1 splint. and F is constricted pupils, the 4. 19.3. Complete the extract from a textbook. Look at the opposite to help you. Retinoscopy. Examine the retina with an ophthalmoscope, if possible, with the pupil dilated to obtain the maximum view. Look for papilloedema and for flame-shaped hemorrhage, and cotton wool exudates. Assess the state of the arteries and know the presence of any narrowing as well as nipping at arteriovenous crossings. Chapter 20. The gastrointestinal system. 20.1. Complete the case report. Look at A opposite to help you. Case 14. Physical examination revealed a thin girl with a slight pallor. She was not obviously dehydrated. The temperature was 38 over Celsius. Pulse 100 minutes. Blood pressure 110 over 80 mmHg. Examination of the rest of the cardiovascular and respiratory systems was normal. The abdomen was not distended. There was generalized percus, which was most marked in the right lower quadrant and was associated with rigidity but no tenderness. There was no remote tenderness and no masses were felt. Vowel sounds were reduced. 20.2. Match the descriptions of the stools 1 to 6 with the condition most likely to cause them A to F. Using your medical knowledge, look at the opposite to help you. Type of the stools: loose, bloody, ulcerative colitis, loose, pale, bulky, obstructive jaundice, clay-colored, celiac disease, black, tarry, gastric ulcer, small, hard, irritable bowel syndrome, clear watery with mucus, cholera. 20.3. Master features 1 to 7 to the doctor's questions. A to G. Look at the opposite to help you. 1. Blood. E. What about the appearance of the stools? 2. Bowel habit. How often do you open your bowels? A. Change in bowel habit. Are you going to the toilet more often than normal? B. 4. Bulk. Is the size of the amount of the stool normal? 5. Color. Have you passed black stools? F. Consistency. Are the motions hard or loose? C. Offensiveness. Do the motions have an unusual smell? D. Chapter 21. Gynecology. 21.1. Write a simple English phrase for each of the medical terms below using your medical knowledge. Look at A and B opposite to help you. Hysterectomy. Removal of the uterus. Menorrhagia. Heavy period. Salpingitis. Inflammation of the tubes. Cervical biopsy of the neck of the womb. 21.2. Read the conversation between the gynecologist and the patient in the opposite and complete the notes about the patient. Menarche, 12 years old. Menstrual cycle, 4 or 5 days. LMP, a week ago. Menorrhagia, no. Dysmenorrhea, no. Discharge, a little. Now write the questions that the doctor asked. Look at the opposite to help you. Menarche, how old were you when you started to get them? Menstrual cycle, are your periods regular? LMP, when was your last period? Menorrhagia, would you say they are heavy or light? Did you get clots. Dysmenorrhea. Do you get period pain? Discharge. A little, white in color. 21.4. Complete the case report. One word is needed. Twice. Look at B and C opposite to help you. A 45-year-old woman has been having heavy periods lasting for 8 days with the passage of clots. For 9 months, there was no bleeding between periods or after intercourse. Her periods were not particularly painful. She had not noticed any hot flushes or night sweats, and her general health had always been good. She had taken the oral contraceptive pill until a year previously, when a copper coil was fitted. She had a normal pregnancy when she was 25. Chapter 22. The Heart and Circulation 1. 22.1. Complete the conversation based on the case history in the opposite. Doctor, what seems to be the problem? Patient, I be getting palpitations. Doctor, how long have you had them? Patient, for about 6 months, but I've had heart problems for years, with tiredness and shortness of breath. In the end, I couldn't walk more than 100 meters without having to stop. I had to sleep on 3 pillows. I had a mitral valve replacement 3 years ago, and that improved things for a while. 22.2. Make word combinations using a word from each box. 2 words can be used twice. Look at B and C opposite to help you. Address. Atrial fibrillation, cardiac output, heart failure, on effort, feeding edema, premature beats. 22.3. Write the words a patient will use to describe the symptoms below. Look at A, B, and C opposite to help you. Dyspnea, shortness of breath, breathlessness. Arrhythmia, palpitations. Orthopnea, breathlessness when laying flat. Edema, swelling of the feet or ankles. 22.4. Complete the case report. Look at A, B, and C opposite to help you. Case 13. A 60-year-old woman attended her GP surgery complaining of breathlessness on exertion. She has been increasing over the previous 8 months until it was producing problems at around 500 meters walking on the level. There was no history of chest pain. She had had several episodes of fast palpitations, which lasted 20 to 30 minutes and were associated with some shortness of breath. She had noticed some swelling of her ankles by the end of the day. It disappeared overnight. Chapter 23. The Heart and Circulation 2. 23.1. Complete the table with words from A opposite. Put a stress mark in front of the stressed syllable in each word. The first one has been known for you. Verb, osculate, noun, osculation. Verb, examine, noun, examination. Verb, inspect, noun is inspection. Verb, palpate, noun, palpation. Verb, percuss, noun, percussion. 23.2. Put the steps from examining the heart and circulation in order according to the 4-stage system. Look at A opposite to help you. First, look for clubbing. Secondly, feel the radial pulse. On third place, locate the apex beat. On fourth place, note any trills. On 5th place, are there any murmurs? And the last step is measure the heart size. 23.3. A doctor is presenting the case of a 43-year-old woman at a meeting in the cardiology department. Complete the text of her presentation. Look at the opposite to help you. On examination, she was pyrexial with a temperature of 38.5. She was short of breath. Her pulse was variable between 100 and 180 and was irregular in time and beat. Her blood Blood pressure was 130/80, and her GBP was up 5 centimeters, showing normal movement with respiration. Her peripheral pulses were all present, and there was no central or peripheral cyanosis. Her upper beat was displaced to the anterior axillary line, but is still in the fifth intercostal space. Her heart sounds were very interesting. When she was initially examined, it was noted that she had pansystolic and mid-diastolic murmurs, her best at the apex. When she was examined some hours later, there was a harsh pericardial friction probes all over the precordium. Our diagnosis at that time was of mitral stenosis and incompetence with a recent onset of pericarditis and atrial fibrillation. Chapter 24: Infections. Exercises. 24.1 Master two parts of the sentences. Look at A, B, and C opposite to help you. 1. 1988 saw the UK launch of lead attenuated measles, mumps, and rubella (MMR) vaccine. 2. Chickenpox, varicella, is a common infectious disease of childhood. Rabies has an incubation period ranging from 4 days to many months. The patient remained febrile with peaks of temperature of 39.5 degrees. He was admitted with a 4-day history of influenza-type symptoms of fever with rigors, myalgia, and general malaise. Quite a proportion of patients who recover from hepatitis B become carriers of the virus. The central part of Africa is in the midst of an epidemic of AIDS. Measles, rubella is most infectious during the catarrhal stage. Lyme disease is caused by transmission of B. burgdorferi from animal to man by ixotic ticks. PUO stands for pyrexia of unknown origin. 24.2 Complete the case report on the patient in A opposite. Look at A, B, and C opposite to help you. Case 45. On examination, he looked unwell. His pulse rate was 100 per minute. He had a palpable spleen. The combination of fever and rigors in a patient who has recently returned from Africa strongly suggests a diagnosis of malaria. The incubation period is usually 10 to 14 days. In this case, the patient admitted he had not been taking antibiotics regularly. The diagnosis was confirmed by the presence of parasites in his bloodstream. 24.3 Complete the sentences. Look at A, B, and C opposite to help you. 1. An infection which can be treated successfully with antibiotics is curable. 2. Another word for an epidemic is an outbreak. 3. Bacteria and viruses are examples of microorganisms. 4. Someone whose temperature is normal is a febrile. 5. The common infection with Epstein-Barr virus is known as a glandular fever.